You must be wondering, why are we studying the muscle attachments in this coccygeal region and why are they so important? If you look at the position of this bone within the body, you can see that it is present right at the base of your vertebral column. So most of the muscles here will provide support for the whole column that enables us to sit upright and allows the normal curvature of the column. The muscles that gets attached over here forms the pelvic floor, and basically they are supporting the pelvic girdle. First of all, we have the gluteus maximus. Now you're looking at the dorsal view of the coccygeal bone. And on either side, basically it gives attachment to the gluteus maximus. As the name is indicating, the word maximus is present over here and indicates basically that it is the largest muscle of the gluteal region. This muscle abduct and extend the lower limb. It gets originated from the gluteal surface of the ilium, sacrum, and the coccyx, and it gets its insertion at the iliotibial tract and gluteal tuberosity of the femur. Coming to the pelvic surface or the anterior surface that is slightly concave, we have the insertion to the coccygeus and the levator ani on both sides. The levator ani is composed of three muscles: puborectalis, also known as puboanalis, then we have the pubococcygeus, and finally we have the iliococcygeus. Now, if you note over here, the names of the muscles are telling you a lot about their attachments as well. If you notice, we have the puborectalis. The name indicates basically that this muscle gets its attachment to the pubic symphysis as well as a sling-like structure around the rectum. Then if we look at the pubococcygeus, so it has two elements. First of all, pubo, which is indicating it gets its attachment to the pubic symphysis, while the second part indicates that it gets its attachment to the coccyx bone as well. Then we have the iliococcygeus, and this shows that it has two attachments to the ilium of the hip bone and the coccyx as well. Now together, these muscles form the levator ani. Now you must remember that the levator ani is a broad muscle, which is a kind of a sheet-like muscle located in the pelvic region. Together with the coccygeus muscle and the other associated fascias, it forms the pelvic diaphragm or the pelvic floor, as you can see in this diagram. The main function of the levator ani and the coccygeus is the formation of the pelvic floor, so it supports a lot of pelvic structures as well as it helps in urination, defecation, etc. To help you remember the muscles forming the pelvic floor, I have come up with an interesting mnemonic, PIC, where the P stands for puborectalis and pubococcygeus collectively. I stands for iliococcygeus, and the C stands for coccygeus. Easy, right? So it's quite simple. Only three muscles to remember: gluteus maximus, coccygeus, and levator ani. Now I'll be telling you about the ligaments attached to the coccyx. You can notice that almost all of these ligaments have the word coccyx in it. So it's going to be very easy for you to remember these names. First of all, we have the anococcygeal ligament or the anococcygeal raphe, which helps in holding the external anal sphincter in place. Then we have the dorsal sacrococcygeal ligament, which gets attachment at the first piece, and the ventral sacrococcygeal ligament over the first two pieces. The lateral surfaces provides attachment to the sacrotuberous and the sacrospinous ligaments as shown here. Apart from this, the first piece also serves as an anchoring point for the filum terminale That is basically an extension of the meninges covering the spinal cord. Let's move on to the comparison between a male and a female coccygeal region.